Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing allergic cause, and on that background, I have discussed with you how you can design any allergy of lungs, sinus, or skin, any organ, on the base principles of Ayurveda. This is very important because nowadays, because of environment outside, because of lifestyle, different food habits, we come across different patients of allergies, and where actual Sanjay Prabhu Prasar of those are not seen every time. So, whenever you are discussing a patient of allergy, you must think of the immunity and hence sthana vaigunya of that particular srotas or organ is to be considered, and this is very important in the treatment. On this background, I will discuss you another point which is very equally important, that we name Vata Pitta Kapha as dosha because they have ability to create diseases or dosha in the body. They are strong enough to disturb our swasthya when they are prakupit, and diseases are seen in the body. No doubt about it. But many a times in many diseases you have to focus on other factors also, and you have to give importance to them when you are treating these patients. Hence, hence, there are five Vadi Ghatak have been discussed in the Grantha. Those, okay, they are strong enough, but along with dosha, dushya, ama, agnimandya, and srota vaigunya or srota dushti are equally important, and you have to take them on primary focus to treat the patient. Hence, these Vedic Ghatak are very important, and in many diseases, in spite of dosha, you have to give importance to them, and you have to think the treatment according to this Vedic Ghatak than dosha. Allergy is one of the example why these five Vedic Ghatak are important, and hence whenever there is allergy, you have to think of Srota Vaigunya or Srotas Dushti, and you have to give the treatment on that particular Srotas to increase the immunity so it can sustain the unsuitable asatmya padartha which come across that Srotas and produce the symptoms. Hence, in Vedic Ghatak, Sruta Vaigunya or Sruta Dushti is important as far as allergy is concerned. We will discuss the importance of other Vedic Ghatak when we are going to discuss importance of other Vedic Ghatak when we will discuss other disease in the course of time. So, allergy, Sota Vaigunya, increase the immunity and treat the patient. This is the formula, or this is the design on the allergy treatment on the basis of Ayurveda. In last episode, I have asked you one question, that when a patient of CAS comes to any doctor, doctor asks one question which is very common, that whether the cough is dry or wet. We can classify these two symptoms as Vatajakas for dry cough and Kaphajakas for wet cough. But I have not seen any doctor or even any patient telling that in the CAS there is Dhumayan, Daha, etc., which are Lakshana of Pittajakas. Though Pittajakas is mentioned separately in the Granth. So my question was, why we ask this to the patient, or patient doesn't, or also patient tells this is a dry cough or wet cough, and I have hardly seen anyone asking about the pittaja lakshana or pittaja kas is seen in the routine practice. What is the reason behind this? That we always think of vataja kas or kapaja kas either when there is a patient of kas, and pittaja kas is rarely seen or rarely, that's why rarely treated also. Now, how Vyadhi is formed, we know that dosh is Prakop and Prakop Prasar, Sanchaya Prakop Prasar, and then Sana Samshraya, and there is Lakshana Abhivyakti. Now, where this Sanchaya Prakop is formed in the body, dosha Sanchaya of each dosh, Vata, Pitta, Kapha, Sanchaya starts in their own ashay first. When the ashay is full of this prakopit dosh, then it is Sanchaya Prakop. When the ashay is full, now it is the dosha are now not a limited space is limited in the ashay, and the prakop of dosha is going on and on. So then these dosha which are sanchit in their own ashay, and the ashay is full, which is called as prakop. Now this further accumulation spreads to other organs or other srotas. What we call it as a sanchaya prakop prasara. After prasara, after occupying other than own ashay to other srotas, or these dosha get accumulated sanchita in that srotas, what we call as sthana samshraya. They get ashray in the other srotas, and then lakshana of any disease we can see in the patient. So what is the main factor in this? That dosha always get sanchit or prakopit first in their own ashay. Now, if I ask you that if you are angry in the home, no matter anyone bothers about it or not, but in that angry mood, if someone asks you that this anger you are showing in your own home, go to the neighbor, go to your neighbor and show your anger in that place, in that ashay. What will you have to do? You have to get first sanchita prakopit for that anger is should be accumulated in your head. Then you have to go to other place which is not your normal ashay or natural ashay. You have to go to first to the other place ashay. Then you have to get anger in that place, sanchaya prakop, and then you should get angry. Hope you are understanding. To get angry in your own home is always easy than getting angry or prakopit in the other ashay, other home. The same thing happens in the case of pittaja kas. In urasthan or in the pranava srotas, there is prabalya of vata and kapha dosh, and there is no as such sthan of pitta. Sadha pitta is there in the hruday, but the functions are buddhi, medha, abhiman, etc. So sadha pitta hardly contributes in the physical metabolism or in the physical activities. So for pittaja kas, pitta has to get sanchit prakopit, and if there is no urasthan as a particular ashay or the pitta dosh, why pitta dosh will go to that place where it is not natural ashay and get sanchit prakopit and prasar. Hope you understand. If pitta has to get accumulated, if it get accumulated in the grahani, which is the main ashay, and the pitta prakopit pitta will create other diseases, or pitta will get ashray with the rakta and rakta pitta etc. disease will be formed. But if urasthan has no by probability, there is no ashay of pitta dosh in any organ of the urasthan, right from nasa to lungs. Why pitta dosh will go there, will get Sanchit, Prakupit, and create Pitta Jagas. In spite, the Pittas will prefer to get Sanchit Prakupit in its own Ashay like Grahani and create that type of Pitta Javyadi. Hope you understand, and that's why it is not easy for Pitta Dosh to travel from its own Ashay to go to other sotas, get accumulated and create the disease. Hence, in practice, you will find Vatajakas or Kapajakas mainly because Urasthan is the Ashay of these two dosha mainly as compared to Pitta dosha. To support this statement, we will discuss other points of this Pitta Jakas in the next lecture. Thank you very much.